Welcome to the Clean Classrooms for Carolina Kids program overview for state and local health department staff. I'm Jennifer Hopenick-Redmond, the overall program director and the project director for the Lead and Water section of the program. This program is a partnership between RTI International and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. Together with my colleagues, including Lisa Green, we'll overview how licensed childcare and public school facilities will participate in the three sections of the program and how local and state health officials can support those facilities. NCDHHS has contracted with RTI since 2020 for the Clean Water for Carolina Kids program to identify and eliminate lead in water at licensed childcare facilities. This work is now being expanded to the Clean Classrooms for Carolina Kids program to identify and eliminate lead and asbestos hazards at public schools, licensed childcare centers, and family childcare homes. In this presentation, we'll cover background on lead and asbestos, how facilities will participate in the lead and water section, and how it differs from the original Clean Water for Carolina Kids program, and also how facilities will participate in the expanded program with lead-based paint and asbestos sections. We'll also hold time for questions and answers after reviewing each of the program sections. Now let's get into the program background. Both lead and asbestos have been used in building materials and still may be present in child-occupied facilities across North Carolina. For lead-based paint, it was primarily used in buildings before 1978 in interiors, exteriors, door frames, stairs, railings, windows, and windowsills. Lead is also used in water infrastructure, including piping, plumbing, fixtures, and solder. Initial restrictions on lead went into effect in 1988, with 8% or less of lead in piping and plumbing and 0.2% in solder considered to be lead-free. Since 2014, lead-free water infrastructure is defined as 0.25% lead or below. Asbestos has also been used in building materials, especially before 1988. It can be found in pipe and duct insulation, building insulation and fireproofing, wall or ceiling joint compound, HVAC systems, sprayed or textured coatings, roofing materials, cement pipes, putty and caulk around windows, and exterior siding and undersheeting, wall plaster, and ceiling and floor tiles. Exposure to lead and asbestos is a public health concern, especially for children. There's no safe level of lead or asbestos exposure. Health effects from lead exposure are irreversible, lifelong, and cumulative as exposure continues. These include issues with hearing, speech, brain and central nervous system, growth and development. Learning and behavior issues also include lower IQ, decreased ability to pay attention, and underperformance in school. Health effects from asbestos exposure increases the likelihood of several cancers, including lung cancer and mesothelioma, laryngeal cancer, and ovarian cancer. In North Carolina, there are now rule requirements to address lead and asbestos hazards at child care centers and public schools. The rules require facilities to 1. Test for lead in drinking and cooking water, 2. Identify lead-based paint hazards, 3. Identify asbestos hazards, and 4. Mitigate or restrict any hazards identified. Water mitigation is included in the program for certified lead-free plumbing replacement and filter installation. For lead-based paint and asbestos mitigation, there are reimbursement funds available in full for licensed child care centers and up to 2/3 of the cost for public schools. As this is a legislatively mandated effort to address lead and asbestos hazards in public schools and licensed child care centers, North Carolina facilities are required by law to make sure all requirements are met. To confirm who's included in the rule requirement and covered with available funding, this program includes licensed child care centers, family child care homes, and public schools, including charter schools in North Carolina. The objective of the Clean Classrooms for Carolina Kids program is to identify and eliminate exposure to lead and asbestos hazards where North Carolina children learn and play. Program organization is set up as follows. NCDHHS is managing the overall funding and contract. RTI is managing the overall program, including the lead in drinking water and follow-up testing and mitigation, lead-based paint risk assessment and testing, asbestos inspection, reinspection, and testing, and overall program management. Liaisons throughout the process include the North Carolina Department of Public Instruction and the North Carolina Division of Child Development and Early Education. For lead-based paint and asbestos, facilities choose whether to restrict or mitigate any identified hazards. They can submit reimbursement requests to the North Carolina Department of Health and Human Services Health Hazards Control Unit. More will come on that from Lisa in the next section. Facilities enroll online by first joining a pre-enrollment webinar and getting an enrollment PIN. Upon registering as a user, facilities complete a training video for each survey to help complete surveys for the lead and water, lead-based paint, and asbestos sections. RTI then notifies facilities about next steps after each enrollment survey is submitted. Specific details about each section will be discussed after this overview. After participation, the facility's results and recommended response actions will be available on their dashboard once they're ready for review. Facilities will be able to easily view all sections, identified hazards, reports, and sample results. Additional videos and resources are available to help facilities understand results and recommended or required response actions. Results will also be posted to our facility data mapper, which is designed for facilities and the community they serve to view the results. It provides a way for the facility to easily communicate results to program staff, parents, caregivers, and students. All results and reports will be shared with the facility first, with a 5 business day delay before they're also shared publicly on this mapper. Use that time to restrict access to any hazards, create communication materials tailored for our communication toolkit, and make a plan for mitigation actions. Facilities should indicate whether access was restricted or the hazards were mitigated, and upload additional documentation so the public can be aware of the actions taken to eliminate lead and asbestos hazards where children learn and play. We also provide resources to help facilities and others learn about the program, all readily accessible on our website, which you can access using the QR code link on the screen below. Our program communication toolkit includes templates for notification emails, draft newsletters, and other helpful items. We also provide reference documents that facilities can share, which include program overview flyers and guides on understanding the program and rule requirements. Flyers are also available for understanding on-site visits. We have an instructional videos page, which includes various how-to videos. And finally, we have a comprehensive list of frequently asked questions that we continue to update about things such as the rules and the requirements, enrollments, and others. We encourage local and state health department staff to communicate early and often about participation in the program with facilities and with us as needed. And if you want to access that QR code, you can now if you haven't yet. Okay, we'll now briefly overview how facilities will specifically participate in the lead and water section and how it differs from the Clean Water for Carolina Kids program. After facility staff attend the pre-enrollment webinar and complete additional section training for lead and water, the facility completes their enrollment survey. The facility will then receive a water sample kit to complete first draw water sample collection when water has not been used in the building for 8 to 72 hours. This is similar to the original Clean Water for Carolina Kids program. This is a key difference between the lead-based paint and asbestos sections of the program, as facilities are using a participatory science approach for water, and this is not the case for lead-based paint and asbestos, as Lisa will later overview. The facility then ships the completed water sample kit back to RTI for lab analysis. Results and recommended actions will be available on the online portal for review, as well as to share those results with other facility staff, parents, caregivers, and students. For any tabs at or above the state action level, facilities can then request mitigation support from our program. Mitigation support may include the full cost of certified lead-free plumbing replacement products and their installation. Okay, who should complete the water enrollment survey for facilities? One or more staff familiar with the facility's building layout, water usage patterns tap to tap, and the ability to collect and ship water samples properly. There are 6 sections of the water enrollment survey. Information is needed on building information, student demographics, the name and location of all drinking and cooking taps, the number of other taps in the facility, water filter type and brand, and drinking water supply. There are specific rules regarding sinks in licensed child care centers. Every child care center should have at least a 2-compartment sink, except for child care centers located in a school that receives food supplies that are pre-prepared and ready to serve from a food establishment permitted by a local health department that's located at the same school campus and provides food during all hours of the child care center's operation. There's also a separate food preparation sink requirement. This is required when a review of construction plans, modifications, or changes in child care center procedures indicates that separate facilities are needed based on volume and preparation frequency. If food is prepared in a child care center classroom, the classroom should also be equipped with a food preparation area. Water from a hand wash lavatory should not be used for bottle warming or to prepare formula, mixed dry cereals, or other foods. This food prep area should be included for sampling. Based on these minimum kitchen requirements, the 2 or 3 compartment dish sink is the sink that every licensed childcare center in North Carolina is required to have, and this sink is allowed to be used for drinking and cooking water, even if a center does not use it. Therefore, every licensed center in North Carolina should sample their 2 and 3 compartment sinks. Since most other sinks in the centers are used for hand washing, including the food prep hand wash lavatory, they are not allowed to be used for drinking and cooking. If the facility happens to also have additional food preparation sinks per 2810C, then those are additional sinks that are allowed to be used for drinking and cooking water, and sampling of those sinks should also be included in the program. For centers located in schools, using the school lunchroom to meet their minimum kitchen requirement per 2810A, the 2 and 3 compartment sinks in the lunchroom still have the same allowed usage and need to be sampled, even if the lunchroom doesn't regularly use them for consumption. These are, by plan review and food inspection, sinks that are allowed to be used for consumption. During operation, for example, if someone is at the food prep sink washing vegetables and someone else needs to fill a pot with cooking water, they may fill the pot at that 2 and 3 compartment dish sink. So for childcare centers located in schools that receive food from the school cafeteria, the school will be testing the drinking and cooking taps in the kitchen and cafeteria and should make sure to include those in the water section of the enrollment survey. And this includes the multi-compartment sink. If schools do not have licensed childcare centers, but do have permitted school lunchrooms, then the 2 or 3 compartment sinks are allowed to be used for drinking and cooking per food code rules. Therefore, these sinks still need to be sampled, even if the lunchroom doesn't regularly use them for consumption. After the facility ships their sample kits back, they're analyzed in the lab and the facility receives the results. They then get a notification to watch a video on how to complete a mitigation request form if they have any drinking or cooking taps at or above 10 parts per billion, the state action level. The facility can choose a full service option whereby all products and labor are paid for and completed by our program, and all mitigation actions will be automatically documented on the facility's behalf in the portal to satisfy the rule requirements. Facility staff can also choose to receive materials only and use their own facilities or plumbing staff. In certain cases where the facility does not use the tap for drinking and cooking, and it was inadvertently sampled, like at a hand wash bathroom sink, which is not used for consumption, restricting tap use by posting signage will be allowable. In most cases, taps will be mitigated with a faucet fixture or water fountain replacement, along with a lead certified water filter installation on critical taps. If a tap is found to have lead levels of 150 parts per billion or more, we will ship another sample kit for 2 follow-up samples to further investigate the source of lead. Facilities will also receive recommendations for results below the state action level. After water mitigation for taps at or above the state action level, a local health officer or regional environmental health specialist should collect post-mitigation samples for the mitigated tap or taps for analysis directly by the state lab. If water is still at or above 10 parts per billion lead, staff should instruct the facility to continue posting "Do not use" for drinking and cooking signage and share results with their utility. The North Carolina Department of Environmental Quality may also be notified to consider additional funding support with the North Carolina Drinking Water State Revolving Fund. With the expansion of the program, it's important to note key differences from the Clean Water for Carolina Kids program to the Clean Classrooms for Carolina Kids program. So, who should complete the Lead and Water Enrollment Survey? All established and new child care facilities operating in their own facility, that means their own physical building, should inventory all drinking and cooking taps and submit an enrollment survey themselves. However, child care facilities operating within a public or charter school should be in communication with the school staff to enroll and test the entire school. Child care facilities operating in public or charter schools should not personally submit a lead and water enrollment survey. This is so that we don't duplicate sampling within the same building facility. Next, what should be sampled? Under the current funding, only drinking and cooking taps used for consumption should be inventoried and sampled. This includes any cafeteria or kitchen taps used for food preparation, such as multi-compartment sinks, bubblers, and classroom sinks specifically used for drinking and cooking, bottle fillers, and water fountains. Facilities should not sample taps explicitly used for cleaning, dishwashing, or hand washing. Licensed child care centers must test their multi-compartment sink if it is the only kitchen sink, even if they do not use it for food prep or drinking purposes. Next, we'll move into key program differences with lead and water mitigation from the Clean Water to the Clean Classrooms program. Local and state health officials will not conduct confirmatory or follow-up sampling when a tap results in lead levels at or above the state action level. Instead, the facility should immediately stop use of those taps for drinking and cooking, post signage, and start the mitigation process. Once mitigation is completed, local or state health officials will be notified to complete post-mitigation sampling. Those notifications will not happen after the initial first draw sampling this time because there is no follow-up sampling before mitigation. Regarding mitigation, facilities can request covered mitigation support with on-site installation, supplies only, or choose to mitigate the taps themselves. Additionally, posting "Do not use" for drinking and cooking signage, signing an attestation, like we said before, is acceptable for taps not used for drinking or cooking that are inadvertently tested. Taps such as bubblers may be capped or removed as well. With help from the local and state health department staff, we can ensure that facilities are properly inventorying their taps and mitigating any taps at or above the state action level. To do so, first, throughout the enrollment survey process, if facilities ask you questions, please ensure that they're only including those drinking and cooking taps we mentioned. You can include and use the following QR code on this slide, or use the bit.ly link to find additional guidance and provide that to facilities if they ask you questions on what should and should not be sampled. 2, ensure that child care centers operating in public or charter schools are enlisting support from school staff. Centers physically locating in school buildings should not enroll. The schools are enrolling and selecting which taps the center or centers also use at the facilities in conjunction with the center staff. 3, it's important that facilities are reminded to complete the mitigation training and request form. This is required regardless of whether the facility chooses to enlist program support or not. Post-mitigation sampling does not occur until after the facility completes the form and mitigation is also completed. At this time, local health officials will be notified to perform that post-mitigation sampling. So if you're wondering why a facility hasn't gotten to that place yet, it's oftentimes because they haven't yet filled out the form. 4, replacement fixtures should be flushed on a daily basis for a recommended 19 days or approximately 3 weeks. Officials should remind the facility of this flushing recommendation and wait to schedule sampling until 19 to 21 days after faucet fixtures are installed if they ask you about this. 5, officials will be notified that some taps may have been decommissioned or designated as hand wash only. You should check signage at those taps during any on-site visits. My colleague Lisa Green, the project director of the lead-based paint and asbestos sections of the program, will overview those sections.
Thanks, Jenny, for that handoff, and thank all of you for joining us today. My name is Lisa Green, and I am the program director for the lead-based paint and asbestos sections of the Clean Classrooms program. Throughout this presentation and with conversation with us, you may hear us refer to LBPA, and that does stand for lead-based paint and asbestos. We've grown accustomed to using that acronym just to shorten the number of words we say and make it easier to talk together. Similar to the water section, there are legislative requirements regarding lead-based paint and asbestos sections. There's a history of regulation in the United States for both lead-based paint and asbestos. Here in North Carolina, we have new legislative rules, and these sections are required for all facilities, regardless of when the facility was built. I can't stress this strongly enough. All facilities must ensure an on-site inspection is conducted by a professional by both lead-based or for both lead-based paint and asbestos, unless they meet certain exemption criteria. If facilities submit documentation of a prior inspection that occurred within the past 3 years, or if the facility provides the building age exemption documentation, they may not need an on-site visit. We'll go into more detail on the documentation a bit later in this presentation. Facilities that do have an on-site inspection are required to restrict access to or mitigate any identified lead-based paint or asbestos hazards. Remember, it's the hazards we're identifying. The results should also be made available to notify parents and staff of the inspection findings. Our Clean Classrooms for Carolina Kids program provides support by reviewing and verifying any submitted documentation of prior inspections or building age exemptions. We'll also be coordinating on-site inspections by a certified or accredited professional, each as needed, and provide recommended response actions for mitigating any identified hazards. In addition to sharing results directly with the facility, we'll also post results on our public facility data mapper after 5 business days to help facilities notify parents and staff of the findings. Legislative funding to partially offset the cost of mitigation is available through North Carolina DHHS. Mitigation or abatement activities are reimbursable for up to 2/3 the cost for schools, and it's fully funded for childcare facilities, including pre-K, Head Start, and after-school programs within schools. As a quick overview of the program, the first step for facilities is to attend a pre-enrollment webinar and complete additional section training for lead-based paint and asbestos in our portal. This training will equip facilities with the tools they need to complete the lead-based paint and asbestos enrollment surveys. It'll also give you a little bit of background about asbestos and lead-based paint if the facility representatives are not familiar with those hazards. Following the training, the facility should select one or multiple primary contacts who will complete the survey and upload necessary documents. Our team will review the enrollment survey responses to determine next steps for the facility. If we determine that an on-site visit is needed, our program will assign a certified or accredited professional to the facility to conduct a lead-based paint risk assessment and or an asbestos inspection as needed. This professional will schedule the visit directly with the facility and will conduct the assessment or inspection, including collection of samples if needed. Any samples collected will be analyzed at an accredited laboratory, and we will provide the facility's results and recommended next steps directly in the portal. Facility administration should notify parents, staff, and students of the results using resources provided by our program, including our facility data mapper, which makes all the results public. If any lead-based paint or asbestos hazards are identified, the facility must restrict access to those areas or choose to mitigate based on the recommended action provided by the accredited professional. If any mitigation activities are conducted, facilities can then request reimbursement from North Carolina DHHS, the North Carolina Department of Health and Human Services. So who should be the primary contact at the facility? Well, the primary contact should be familiar with any lead-based paint assessments or asbestos inspections that have already been conducted at the facility. They should also be familiar with the layout of the building or buildings, if there are multiple buildings at the facility, and if asbestos hazards are identified during the on-site visit. The primary contact should be able to oversee the efforts to restrict access to those hazards or to mitigate those hazards. The facility should designate primary contacts to complete the surveys and be the main points of contact for the lead-based paint and asbestos sections of the program. What information is needed to enroll? Well, there are separate enrollment surveys for lead-based paint and asbestos, but the following information will be needed. We'll need building information, facility type, approximate size and age of the building, and schedule of operations. We'll need some information about student demographics, the number and age groups of enrolled students, and race or ethnicity student percentages. We'll also need the previous inspection information I've mentioned before. If the facility has already been inspected for lead-based paint and or asbestos, then the facility will be directed to add an inspection record, including the inspection date, whether the whole facility was inspected or part of the facility was inspected, and they'll need to identify the group that performed the inspection. We'd like to know any concerns about lead-based paint and asbestos exposure, anything that the facility reps are concerned about now, such as peeling paint or damaged floor tiles. We'll need to know about past renovations, and we'll need to know about planned future renovations. And we'll need documentation of prior inspection of building exemption age exemptions. The facilities will be prompted to upload these specific documents, documentation of prior inspections, building age exemption documentation, based on their answers in the survey. There are two types of exemptions based on uploaded documentation. The documentation must be submitted to RTI for review and verification in order for a facility to be formally exempted from an on-site inspection. For the lead-based paint section of the Clean Classrooms program, facilities may be exempt if they provide documentation associated with a lead risk assessment already conducted within the past 3 years that meets all the legislative rule requirements. If the facility indicates they've performed mitigation or abatement to address any identified hazards, those records will also be requested during the survey. Facilities that were built after 1978 may also be exempt if a responsible individual for the facility signs an attestation that no lead-based paint was used in the buildings. The attestation is provided during enrollment for signature. For the asbestos section, facilities may be exempt if they provide documentation of an asbestos inspection conducted within the past 3 years that meets all the legislative rule requirements. If the facility indicates they have performed mitigation or abatement to address any identified hazards, those records will also be requested during the survey. Facilities that were built after 1988 may also be exempt. Schools must provide an AHERA asbestos inspection exemption letter for all buildings. AHERA is the Asbestos Hazard Emergency Response Act. They'll need to provide that exemption letter for all buildings that states that no asbestos was specified for use in the construction of the building. Childcare facilities must provide a property tax record that shows all buildings were built after 1988. We estimate approximately half of the enrolled facilities will need on-site inspections for lead-based paint and asbestos based on building age alone. This assumes that the other half of facilities not receiving an inspection submit the required building age exemption documentation. These estimates do not account for facilities that submit prior inspection exemption documentation, which will be a significant number of schools for asbestos, giving AHERA reinspection requirements already in place. After the enrollment surveys are submitted, our team reviews the provided information and documentation to determine next steps. If the facility meets the requirements, the criteria for an exemption due to a prior inspection or a building age exemption, the facility will not need an on-site visit. They will be notified by our program that all rule requirements have been met and no further action is required on their part. This will appear on the facility's dashboard and the public data mapper. If the exemption criteria are not met, the facility will require an on-site visit by a professional, which will be coordinated by our Clean Classrooms program. If an on-site visit is needed, our team will assign a certified or accredited professional to the facility. During the enrollment survey, the facility will have an opportunity to request a preferred company if, for example, they've already worked with a company in the past and have a good working relationship. We will do our best to prioritize previously established working relationships between facilities and companies. Once assigned, the certified or accredited professional will communicate with the primary contact to schedule the date and time for the on-site visit at a time that works for both the facility and the professional. The professional will perform this scheduled on-site visit at this mutually acceptable time. For lead-based paint, the risk assessment process will likely include a visual inspection to locate any deteriorated paint, as well as the extent and cause of the deterioration. The professional will also perform an assessment of the exterior and interior surfaces of the buildings and any outside areas using a portable X-ray fluorescence instrument, which is a real-time detector, a real-time analyzer that can identify lead and quantify the amount of lead present in seconds. If needed, the professional may also collect samples of paint chips, settled dust, and soil. There are situations in which the portable handheld instrument cannot be used to take the measurements. It's not easy to access. And in those situations, the inspector, the risk assessor, will collect samples to be analyzed at a lab. For asbestos, the inspection process will likely include an inventory of suspect building materials and an assessment of the material's condition. The professional may also collect samples of building materials to send to a lab to identify if they contain asbestos. And finally, all results and recommended actions will be made available to the facility in the portal. And facilities will be notified by email when the results and the report are ready for their review. The facility's primary contacts also have a key role when it comes to preparing for the on-site visit. They should be available to schedule the date and time of the on-site visit when the certified or accredited professional reaches out. The primary contacts should also plan to meet the professional when they arrive at the facility to grant them access to conduct the on-site visit. And lastly, the primary contact should have the facility's floor plans available for the professional to review during the visit as needed. On-site visits can occur during normal hours, after hours, on weekends, or during vacation breaks. Facilities can remain open during the on-site visit. However, localized areas may need to be closed at the discretion of the professional. In general, on-site visits are estimated to take between 1 to 3 days depending on the size of the facility. And just a note here while I'm thinking of it, throughout my presentation, you've heard me refer to certified and/or accredited professionals. In the parlance of the industry, the lead professionals are certified, the asbestos professionals are accredited, and that's why you hear us use both words. For lead-based paint, if no lead-based paint hazards are identified during the on-site visit, no additional action is required by the facility. As defined by the rule, a lead-based paint hazard is any lead-based paint, lead dust, or lead in contaminated soil that is above the state action levels and is likely to result in exposure to lead. Properly managed lead-based paint in good condition is not considered a hazard under this program. There is no requirement under this program to restrict access to or mitigate lead-based paint that is in good condition. However, if lead-based paint hazards are identified, our team will recommend response actions depending on the condition and type of hazard, such as a paint, a dust, or a soil hazard. Recommended response actions may include mitigation activities such as interim controls, abatement or renovation, repair, and painting, also known as RRP activities. The facility is required to restrict access to the hazard until it is mitigated. If the facility chooses not to mitigate, they must restrict access to the hazard indefinitely. For asbestos, similarly, if no asbestos hazards are identified during the on-site visit, no additional action is required by the facility. As defined by the rule, an asbestos hazard is any asbestos-containing material or a material that contains greater than 1% asbestos by weight that is damaged and may result to release of fibers and exposure to asbestos. Properly managed asbestos-containing materials in good condition are not considered a hazard under this program. There is no requirement under this program to restrict access to or mitigate asbestos-containing materials in good condition. However, if asbestos hazards are identified, our team will recommend response actions depending on the condition and type of asbestos-containing material. Recommended response actions may include mitigation activities, such as repairing the material, encapsulating it, enclosing it, or removing the damaged materials entirely. The facility is required to restrict access to the hazard until it is mitigated. And like the lead-based paint, if the facility chooses not to mitigate, they must restrict access to the hazard indefinitely and manage the material in place. It is important to note that facilities are responsible for deciding on any mitigation or abatement activities and scheduling those activities. Recommendations may be provided, but the facilities are responsible for deciding. While the costs of on-site visits and sampling are covered by our program with no out-of-pocket costs to the facility, mitigation activities are reimbursable through North Carolina DHHS, the Asbestos and Lead-Based Paint Reimbursement Program, the ARPA reimbursement program. Child care facilities can request reimbursement for the full cost of qualifying mitigation and abatement activities, and public schools can request reimbursement for up to 2/3 of the costs. And please note that mitigation activities should be scheduled when the facility can be mostly unoccupied. Depending on the size of the mitigation area, the timeline for mitigation can vary. The facility needs to be unoccupied during mitigation activities, unlike the inspection activities, which can be scheduled around occupied activities. You can visit the North Carolina DHH website by following the link or using the QR code on our slide for more reimbursement, for more information on reimbursement and the mitigation activities that are covered. As described in the agreement addendum, local health departments will support the implementation of the new administrative rules by conducting at least one site visit at schools and child care facilities where lead-based paint hazards were identified and the facility decides not to pursue abatement. The purpose of the site visit is to ensure that the facility is restricting access to the hazards and to complete a checklist to confirm the hazards are inaccessible. Additionally, the local health departments should continue to be available for consultations related to lead-based paint hazards at the facilities. The checklist will be provided by our program and will be downloadable with information specific to each facility. It will include a table with a row for each hazard that contains the description of the hazard and the location, the recommended action provided by the certified professional, any actions listed by the facility after they reviewed their results and took some action, and an option to indicate if the hazard is being restricted. The picture shown here is a draft version, and it will likely be refined in collaborations with the state. We're also developing a checklist for asbestos that will be available for the industrial hygiene inspectors in the Health Hazards Control Unit to confirm the inaccessibility of the asbestos hazards. Thank you all. On behalf of the Clean Classrooms for Carolina Kids team, thank you for joining and taking steps to protect North Carolina's children from lead and asbestos hazards across the state. If you have any questions, please feel free to contact our team. You can contact us at our website, cleanwaterforkids.org/Carolina, or call or text us at 1-855-997-2864. Thanks.